Hello? Yeah. Thank you, Stephen, for a really nice summary also and an outlook of where we need to go. And you've already raised yourself some questions. I want to first go back to this issue around management and leadership. You said you don't really agree, or you partly agree with Henry Mintzberg, and that it's more of a continuum of leadership, but you do need to realize that there's distinct personalities, distinct capabilities. Where do you see the difference, and what kind of competencies, what kind of skill sets are there that define the good leader and the good manager?
Yeah, so what I was referring to there, I don't fundamentally disagree with Henry, but it really is a matter of empowerment of the people on the front line. It's one of the key tenets of the lean management system culturally. Forget the tools. I mean, the tools are important. It's empowering that nurse, the doctor, the medical assistant on the front line that touches the patient, to empower them to be the problem solver. Often leaders and even managers think they have to solve the problem themselves, but you need to increase the problem-solving capacity of the people doing the work. And then some people have different abilities to do that, right? And all I'm saying is the kinds of competencies that an organization needs, it's not either or. You need a compilation. Some people are going to be stronger at leading, depending on how you want to define that, right? Articulating the vision, motivating others, et cetera, playing external roles. Others are going to be much better at implementation, right? The skills of getting things done on the ground, but don't ask me to go to this meeting and make an argument so-and-so, or don't ask me, I'm an introvert, let's say, don't ask me to be the rah-rah leader. That's all I'm saying. People have different abilities, and savvy managers and leaders recognize that.
And I guess that it is also really a skill of self-reflection to know what is it that I cannot do, and where do I have to delegate, where do I need to find other people to support other people so that they can also thrive?
Yes, absolutely. It's awareness. A lot of it is self-awareness, being aware of your preferences, not just your ability, but your preferences. And one of the most effective leaders I've observed, I kind of alluded to it earlier when she would be very good at recognizing her limits, but she had others on her staff who had those skills. And she would say, Mary or John or whatever, you do that, you're going to get the credit, even though people kind of look to me as being maybe inadequate. Why aren't you doing that, kind of thing? But that's part of the culture change. And it has to come at governance level, at the board level as well, to support that kind of leadership, because leaders come and go in healthcare 4 or 5 years sometimes, and unless it's part of the culture of that organization to empower the front line, to use data to problem solve, then it goes away when that leader goes away. It really needs to be embedded in the culture.
Part of embedding it in the culture, and also part of building this new kind of service delivery, is a learning environment and a learning organization, which also reflects your point around we need to evaluate more, we need to be more stringent, we need to know what we're actually doing. Right. But it is really difficult to then give that feedback and create this kind of learning environment. Where do you see potentials, or how can we get there to create this, use the data, use the evaluation to actually move forward?
Yeah, again, I think it comes from embedding within the organization, the leaders and managers, a learning kind of culture. And that begins with an understanding of what it is we're trying to do as an organization. And every one of our jobs, when we come to work every day, it's really simple. It's 2 things. One, to do our jobs the best we can as we understand it. The other is to improve our job, to improve what we're doing. But for learning, you can do those 2 things. As challenging as that kind of mindset is, that creates silos. So you have to go one step further, I think. Your job is not only to improve your job, but think of the consequences of that for the others on the healthcare team you're with, because healthcare is so interdependent. So maybe I'm a nurse on 3 North. I noticed something yesterday. I noticed we could do it better, but that might, how's that going to affect 3 East? Or how's that going to affect the laboratory? Or how, what I'm saying? So it's a very much team-oriented kind of learning. And so one of the best ways of, I think, fostering that is in daily huddles. primary care and not just inpatient units. Daily huddles where you can adjust on the fly. And Henry said it well, you know, it's strategic planning, forget it, but strategizing on the fly, adjusting, constant flexibility. How do we improve? How do we improve together? What if we did it this way rather than that way? And continued experimentation with the PDSA cycles. Not being afraid, this is a big thing in healthcare, not being afraid to fail. You know, we have this mindset, oh my God, you know, are you saying the surgeon's supposed to screw up? No, we're not talking about that. But you really got to try things. You can't always get it right the first time.
I'd like to conclude with a last question, because both of you, but also, of course, Michael Marmot in the morning, underlined the importance of involving the community, understanding your community, understanding the neighborhood, the social determinants of health. But how do we actually get to that, not doing to, but doing with them? Yeah,
it's a great question, Victoria. By the way, Sir Michael is a graduate of Berkeley, okay, one of our alums. He got his PhD in Epi at Berkeley with Len Simon in the 1980s and then went back to the UK. We had him over about 3 months ago where he gave a similar, very inspirational talk as well. So we proudly claim him. So one of the things about engaging the community, a lot of it has to come from the community. You have to make yourself vulnerable. You have to say, look, you know, we don't have all the answers. And one of the things some of the students I've had over the years who've gone on in their careers have learned that the official community leaders sometimes aren't really the ones that need to be involved, aren't really the stakeholders. I mean, they are, but they're not the only ones. You need to dip below them to get at the real voice of the community, because sometimes their leaders are there for various reasons, and the community itself maybe doesn't cohere around that particular person, organization, or position. So you have to kind of be a little bit savvy about your community and who are the informal leaders, for example, at different levels, and not just the people who hold elected office or are, you know, the presidents or whatever, of voluntary groups in the community. But it's an ongoing, it doesn't end. It's an ongoing kind of challenge to figure out really what the needs are and how to best attack them. Yeah.
Thank you very much.
Yep.
Thank you.
Yeah.